Thanks very much, Gary. I'm pleased to be here and have got the stopwatch on, so I stay within my 15 minutes. I want to start, so my talk's going to be a bit glum, I think, in the end, because I'm going to say why things can't happen. But I really want to start with an affirmation that we have the technical knowledge, the capability and the wealth in this country to have a far better aged care system. So no one listening today should be in any doubt that we can do much, much better. And it really is to do with the will. It's not that we don't have the resources or we don't have the knowledge or we don't have the capability. All of that exists. It's just we haven't harnessed it, and we haven't harnessed it together. My reading of the Royal Commission, I think, and I'll come to that in a little bit more detail, is that the political appetite for change is incredibly low. Having said that, we also need to recognise that as low as the appetite is now, it's probably the highest it's ever been in the last 50 years. So this can't be an opportunity that we miss. We've got to transform that low appetite for change at the political level into real change. Otherwise, those opportunities aren't going to occur in our lifetime. Why do I say the political appetite is low? Well, we have past history. And although past doesn't determine the future, we've had over 20 inquiries into aged care in the last 2 decades. So it's multiple governments, multiple ministers, different flavours of government and political parties have failed to act. And so this isn't happenstance or chance. And one of the disappointing things for me with the Royal Commission is they didn't get down to the root cause of why there had been inaction on 20 separate inquiries. And to me, this goes to a major failing within the bureaucracy and the relationship between the bureaucracy and the ministers and the cabinet. There's been too much reliance on our business model and assuming that the market will regulate aged care, and it was never going to regulate aged care from when the Act was determined in 1997. And most people in government do not see it as their job, and we see that by the appointment of a junior minister if a minister's employed in the role for aged care. So we've had 20 years of inaction and 20 years of avoiding the issue with no real consequence. No one's lost government because of poor aged care. No one's actually really lost their ministry because of failings in aged care. And we saw that again with COVID. So there is no internal impetus in government to act. If we now look at behaviours around what could be done around knowledge that exists and comes to the department without too much effort, the Serious Incident Reporting Scheme, which requires reporting of sexual assault, physical assault, the federal department's been collecting since 2007 and have done nothing with that information to improve aged care or address systematic change at a national level. And that's data they've asked for that comes to them. The regulator now has that role, and it'd be interesting to see whether they do anything with it. But again, I don't believe they're equipped to deal with that type of work. The coroner's investigations of premature and preventable deaths have been ongoing since 2000 or since the court existed. And we regularly present cases every quarter to the sector on lessons learned from coronial investigations into deaths. The health department has not used these. They're not propagated nationally, and they don't act on themes that continually recur. So even when they're handed information about poor care, they still don't do anything with it, even when the solutions are provided through the court. The Royal Commission's done itself a disservice. So the 2 commissioners have disagreed. And so this now gives the government a legitimate out. And so do they now have a third option of saying, well, both disagreed, this is too hard, we send it back to be looked at, or we have chosen a third pathway. The discordance was unnecessary because I don't believe the commissioners disagreed on the principle they wanted addressed, but they disagreed on how it might be done. And I think we would have been far better off if they had spoken about transparency with regards to the finances and accountability, and also that the need for a governance structure that is actually engaged with and acting on behalf of older people. And so that the Commissioner Pagoni has asked for a separate organisation to lead aged care, and Commissioner Briggs has asked us to forgive the Health Department and give them a second chance. Both have been, both recommendations, I believe, come from their own lived experience about how things get done. The other issue, apart from the discordance, is there's 148 recommendations. Do all of the 148 need to be implemented? Are some more important than others? Are some dependent on others to be done? And so there's no information here about, let's say recommendation 50 can only work if you've actually put in place recommendations 1 to 15 and 20. So there's no, I think, real tale about how those recommendations intersect. And in a sense, what we've got is a smorgasbord that delivers something for everyone, but potentially nothing for the system as a whole. I think the most egregious failing has been the lack of a consumer guide. The Aged Care Commission was set up in a different model to every other Royal Commission in the past. So Commissioner Briggs is not a lawyer. It was set up to look at aspirational rather than investigate the causes of failure. And I think not addressing the causes of failure remains an issue, but failing to deliver a consumer guide. So the Royal Commission was meant to be acting on behalf of older Australians, and there is no guide that I am aware of that tells older Australians, this is what the Commission found, this is what it means for you, and this is a explainer. And they should have done that, and they're able to do that. Other things that could have been done that haven't been done is restrictive practice. Guidelines about restrictive practice and eliminating restraint have existed since the early 2000s. It remains a problem 20 years on. The young people in nursing homes issue, a Senate inquiry from 2005 saying it wasn't acceptable to have young people living in nursing homes and this should be solved. Nothing happened in that space for almost 13 years until the Royal Commission asked the department what were they doing about the Senate inquiry. So that hasn't changed. The easy fix of home care packages has dragged on and on and on, and doesn't need a Royal Commission to say if people are waiting for care that this should be fixed. So there's your history of nothing happening despite it all being there. The Prime Minister's press conference immediately after the release of the Royal Commission, noting that he had the findings for 2.5 days, he holds a press conference just before he tables the document, and you can't access the document till after he's finished his press conference, and there's not been any revisiting of that, shows that he really didn't want to address the issue. If you go back and review that he says words like, this is complex, this is hard, it's going to be expensive, it takes time. So in the language of politicians, taking time means we're probably not going to do anything. Expensive means that, do you want me to raise your taxes? And I'm sure you don't, so you're going to be on my side when we don't spend so much. And it's complex and hard is not actually true. It's not complex and hard. It's no more complex. The complexity is not beyond our capability of a modern contemporary society with the knowledge that we have in 2021. It is not complex. It's just going to take a bit of hard work. It's going to take hard work to do it and dedication, but it's not complex in the sense that it can't be done. The other issue is that the federal government again played their smoke and mirrors game with the Prime Minister announcing $450 million being released alongside the Royal Commission's meeting. And anyone who wasn't listening carefully might have thought that this money was intended as a response to the Royal Commission. In fact, $270 million was allocated to the aged care providers to keep them operational till the end of June. So none of that money really was dedicated to implementing anything from the Royal Commission. So the journalists really didn't pick up on that, haven't pursued that issue at all. The question now is, why should the government act? What's in it for them? Do they get votes? They don't get votes from the 200,000 residents. Most of the residents in aged care centres often don't vote or are discouraged from voting, are unlikely to be in swinging seats, or their votes, which are spread over 2,700 facilities as a collective, won't impact. So the votes of the individuals doesn't matter. In terms of accountability, this is really a federal government issue. Almost every other issue, we have the states or the community come in swinging with a seat at the table. The states don't want a seat at the table, and you would have seen the argy-bargy between Victoria and the federal around COVID, how each was trying to say, not my job. They didn't really, in the end, say, I will take responsibility and make sure it gets done. There's no bipartisanship around aged care. There is in other areas, but not in aged care. The cost, and it will cost money, but even if we double the amount of money needed, it's still going to be only 1 to 2% of GDP, which we can afford. So there's nothing in it for the government. There's no votes. They're going to have to increase taxes or spend on something else. What's in it for the taxpayer? And here is, if you ask people, where would you rather spend $1,000 on a young person or an old person, it'll always be spent on the younger person. Do you want to spend the money on a healthy person or on aged care? You want to spend it on healthcare. Do we want the Olympics, or do we want slightly better gravy for people in residential aged care? The vast majority of people are young, able-bodied, and young people and able-bodied people, including able-bodied older people, want services that help them, not the people that they don't identify with. I'm just really aware of the time and racing through this. What's politically doable is a new act, a new regulator, new standards, new items for payment to allied health and clinical professionals. And they're in the recommendations. What's going to be hard to do is the increasing salaries for staff and making sure that money stays with the staff and doesn't go to the provider. And that the medical input is actually a co-share arrangement where there is a shared care model for older people. And I think what the Royal Commission has provided is, when you strip it down, it reads as more money for more people will lead to a better system. Whereas what we know in healthcare is more people doesn't lead to a better system. Better transparency, better accountability, better teamwork, and a greater level of empathy into what you're doing is what makes a system better. And so I think it's those things that are needed. Success in advocacy, and one of the things that we need to remember here is that the civil rights, the feminist movement, HIV, breast cancer management, all improved because people that were directly affected came with their personal story, which made the community empathize and identify, and they made a stand and said they weren't going away. And we see this now with Grace Tame in particular, who has given voice to, egregious acts of the past, and it's clear that grace is not going away. And so the government now has to deal with a problem that has been present, for a millennia. And it's because Grace Tame is able to get people to engage with what happened to her, and she has the fortitude and the guts to be clear that she's not going anywhere and this problem must be dealt with. You can't be fobbed off. The Council of the Elders is a small step, and I think a very, very small step towards having advocacy. And my biggest concern is that the Council of the Elders, which is really the only consumer-based action in those recommendations, people will put a tick next to it and say it's done. When I say, how will 10 people represent 200,000 with all their different needs? And will we only end up with able-bodied, cognitively intact, middle-class people who have the capability to apply to be on this Council of the Elders? And so we really haven't changed the system.
So I might just get you to round it off because we're racing in terms of time.
Sorry, Greg. So I just want to reiterate that Australia is one of the 5 or 10 wealthiest countries in the world. If we were to double the amount of money going to aged care, we'd increase that from 1% to 2% of GDP. We have the technical knowledge in medicine, nursing, personal care, aged care. We have all of that. We have the knowledge in terms of human rights law, laws around accountability, transparency. All of this exists. What's missing is the will to act. And I think it's now up to us to really force that. If we miss this opportunity, it's not going to come back.
Great. Thank you very much, Joe. And I think one of the things that you raised is, particularly at the beginning, I mean, you precursored your speech by saying that this is going to be pretty glum. And it probably is pretty glum, but some of the comments in the chat have been that, you're stating what is the reality. And there have been some other comments around, I suppose, even though there are 2,700 facilities spread across the country with older people in them, which dilutes the vote and therefore doesn't have the power to change government, there's a whole lot of people, which has been commented on in the chat, that are connected to those people in those aged care facilities that expand the power of the vote. And I suppose what I'd ask you is, one of the things I heard you speak yesterday was you used a metaphor of the diamond on the drill, and how we actually get people to a point where they're affecting change at an individual level.
I think that I think you need to be highly active, and I think that we no longer live in a world where you can trust people in authority.
Yeah.
And it turns out that we should never have trusted people in authority. So we need to remain vigilant, and we need to go back to what it means to be a member of society, a member of the community, and a taxpayer. Is we have rights, and if we fail to exercise them, then they will be ignored. I think one of the things I would have liked to have seen is that the 200,000 residents are a separate, and I don't know how you do this, but they would have 2 seats in Parliament. So you pull those 200,000 people together and you say they have 2 seats in Parliament that they can vote on, because that's roughly the area for each electorate. If you really wanted to shake loose some of the thinking. But as I said, if we do nothing, then nothing will happen.
Yeah.
Because there's no reason to do that. And you have to remember, and I got into trouble for this, is that people in our position that are well educated, financially well off, can speak up, often don't need the aged care system as much as people that aren't so fortunate. And so we tend not to worry about it so much because we think we're going to be okay or we'll navigate it. But that's not the case when you're older and dependent. You lose your autonomy and you lose your ability to speak up. The minute you depend on someone, you struggle to speak up no matter who you are. And I still remember I looked after a Supreme Court judge when I was an intern. And the Supreme Court judge was powerless to a 23-year-old junior doctor because of the dynamic that we were in. And that person was dependent on the team and dependent on me as the junior doctor on the team to do what was needed. So he wasn't telling me off. He wasn't giving instructions. And that stayed with me my entire career about, you may be incredibly powerful in your role in the community, but the minute you have a health issue or a dependency issue, the scales completely flip.
Yeah. Yeah.